Dr. Spiegel, could you please just summarize for the jury the conclusions you came to with your opinions, and then we'll take you through the specifics.
So in my opinion, based on a review of the evidence, based on my clinical experience, based on my publishing experience, based on my teaching experience, that Mr. Depp has behaviors that are consistent with both someone who has a substance use disorder as well as consistent behaviors for someone who is a perpetrator of intimate partner violence.
Thank you. I'm going to start with the impact of drug and alcohol abuse over time. First of all, based upon your review of the record evidence, what type of drugs has Mr. Depp used?
So Mr. Depp, and I'm talking about use, we're talking about a substance use disorder here. We're not just talking about use. Okay, so we are talking about alcohol, we are talking about amphetamines, we are talking about marijuana, we are talking about cocaine, we are talking about LSD, we are talking about ecstasy, we are talking about opiates, we are talking about prescription benzodiazepines, and we'll get into a separate thing about the abusability of Seroquel and or gabapentin and Neurontin. And we are talking about much of the time concurrent use, meaning simultaneously.
In your practice, do some patients suggest to you that drugs and alcohol actually help them?
So I think it's patients who lack insight or are in the very early stages of recognizing they have a quote unquote problem will sometimes actually say that they have this medication actually calms me down. This medication makes me feel better. And in actuality, they may not acutely feel anything, but chronic and continual use will take its toll on the brain. So the answer is yes, but again, people who have substance use disorders have lack of insight and a lack of judgment about what's going on. They're very poor moderators of their own behavior.
Has Mr. Depp suggested, based on your review of the record evidence, that alcohol and drugs actually help him?
In review of the evidence, he has suggested that alcohol, Xanax, I'm in the list of medications, do help. Although I will also tell you on review of the evidence that there were at least 2 times I can remember that Mr. Depp was referring to at least short-lived periods of sobriety, and I cannot exactly tell you what that included, that both times he said that he functioned better and that he recognized that alcohol and drugs was at the root of his problems.
With review of the images and the x-rays, I mean, this was a crush injury. That would generate the findings clinically on x-ray that we saw. The fracture is a we call it comminuted, and the tip of the finger is in multiple splinters, so there are multiple fragments, and typically you see that with a crush type injury.
So a comminuted fracture is one where there's multiple fragments of bone?
That's correct.
And what was the basis, other than what you've read and heard, but from the pictures, what was the basis of your opinion that the hand was resting palmar side down?
Well, that was the way the injury was described and demonstrated in the videos. And so in that position, were the bottle to strike the finger the way it was described, it would have struck on the nail, and the nail was really not injured, and so that's not consistent with that pattern of injury.
Tell us, in relation to your expert opinion on the cause of Mr. Depp's injury, tell us what you see in this picture, please.
So this is looks like an avulsion type injury where tissue's actually pulled or pinched away. I think what's important in this picture is that the tissue loss is on the palmar aspect from underneath the finger rather than then all transversely in the finger, which you would anticipate if the bottle struck the finger, you would expect more of this level of injury rather than isolated to the palmar aspect.
And what do you notice about the condition of the fingernail in this picture?
So from this image, the fingernail appears to be intact. You can't necessarily see the entire nail, but there are other images that have a better profile of that. And the nail's not elevated. There's no subungual hematoma beneath it, or there's no bruise underneath it. Anyone that's ever stuck their finger in a drawer or caught it in a car door or hit it with a hammer knows that almost immediately there's typically bleeding underneath the nail, which creates this hematoma.
So, not being a doctor, I'm going to try to summarize what you just said. Are you saying that in an injury like this, if something had come from the top, that there would be an immediate impact to the fingernail bed?
That's correct.
I stood up and I walked behind the bar, and there was a larger bottle of vodka, the kind with the handle, on it. I grabbed that and I went and I sat in my seat again. I opened the bottle and I poured myself a shot. Drank it. Miss Heard was flinging insults left, right, and center, and she then grabbed that bottle and threw that at me. And the way that the bar was situated and where Miss Heard was, so if I could show you, so if this is the bar where the glass was and the bottles, if this was the bar and I was sitting here like this, she would grab the bottle and she would go there, she went there. And so I was leaning like this in the chair, looking at her. First bottle went, then got the other bottle shot. Takes the second bottle, which was the larger one. I'm in this position again, and my hand is on the edge of the bar, like that, leaning over, the fingers like that, and she threw the large bottle, and it made contact and shattered everywhere. And I honestly didn't feel the pain at first at all. I felt no pain whatsoever. What I felt was, I felt heat. I felt heat, and I felt as if something were dripping down my hand, and then I looked down and realized that the tip of my finger had been severed, and I was looking directly at my bones sticking out, and the meaty portion of the inside of your finger, and blood was just pouring out. And at that point, I think that I went into some sort of, I don't know what a nervous breakdown feels like, but that's probably the closest that I've ever been. Nothing made sense. And I knew in my mind and in my heart, this is not life. This is not life. No one should have to go through this. And as I said, this feeling of nervous, being in the middle of some sort of nervous breakdown, I started to write with my blood, in my own blood, on the walls. Little reminders from our past that essentially represented lies that she had told me and lies that I had caught her in. And then the next thing, amongst all the madness, I would again hide in the bathroom or wherever, and I texted Dr. Kipper and I said, you might want to come over. I've cut my finger off here.
Which finger was cut, Mr. Depp?
It's the middle, it's the funny looking one. It's the middle finger here. You can see you can see all the sort of, from the initial wound, all these bones up here were crushed, and it looked like Vesuvius, and so this part of my finger now is, so that because of not having use of the tip here, this is basically arthritis that kicks into the joint once that upper part of the finger is mangled.
So is that the right middle finger?
Right middle, yes.
And is that your dominant hand?
Yes, it is, yes.
Can anybody out there